You're watching the new mindset of the Coachella Valley. Well, hi, friends of the Coachella Valley. Jose here from the New Mindset. I'm bringing you another fantastic episode, and this time we're going to be talking with Tranquility Sands. I can't wait for you guys to hear the story. I've already got a little taste of it, and it's amazing. I'm doing this new format on a podium, which I've not done before. I'm very excited for it. Nervous, yes, but excited. Let's get to meet them and see what it is that they do. So, guys, thank you for being here. Really appreciate you.
Thank you for having us.
So I know the name of the place is Tranquility Sands, but could you each introduce yourselves and tell me what you do or what's your role in the place?
Okay, I'm Catherine Javier. So I'm what they call the Director of Patient Care Services.
My name's Tristan Reparejo. I'm one of the nurses. I'm also the assistant administrator.
My name is Howard, marketing and clinical services for patient care.
My name is Patrick. I'm an administrator, but just like all of us, I'm a nurse as well.
That's awesome. Well, guys, thank you for being here. And together you form Tranquility Sands. Now, I only just recently got to hear a little bit of your story. I'd love for all of our viewers to understand what it is that you do. So let me just start off from the top. Are all of you guys local here to the Valley? Did you grow up here or did you guys grow up somewhere else?
I've been in the Valley for half of my year. So I graduated nursing in the Philippines and I came here.
I was pretty much raised out here. Went to Cathedral City High, graduated from college's Desert Nursing Program, and then worked my whole career over at Desert Regional before we opened up the doors.
Nice. Okay.
Also grew up in the Valley. Came here when I was really young, but Palm Springs High School, been a local, College of the Desert Nursing Program.
Okay.
Program, by the way. Been a nurse for a good 25 years and at Desert Regional ICU.
And I actually started my career in healthcare in Indiana, South Bend, Indiana, home of the Irish, of course, and did my nursing school there, and then came here to Palm Springs as a traveling nurse and stayed here ever since. And I came in 2007.
So as you guys mentioned, thank you for sharing, you are all in the medical field. So at one point, you all came together and came up with the idea of Tranquility Sands. First off, can you guys tell me what Tranquility Sands is?
So the actual business is a hospice provider out here in the Coachella Valley. And what we do is support patients and families who are going through terminal disease and want to be comfortable in a place that's comfortable.
How was the idea of this place created? Like how long ago was it and who came up with the idea first?
Actually, it was like we were in different places at the right time. So it was during the height of COVID. So we all work in the ICU at Desert Regional Medical Center. And then we were working one night, me and Howard, we've known each other for half of our lives. We met in the hallway and all of a sudden we said, oh, why don't we just put up a hospice? And then during the height of COVID, we saw a lot of people dying, a lot of the old people that doesn't even have family members at bedside. So that provoked us to start hospice.
You had the idea, you had the
We had the
conversation.
idea.
So
yeah.
originally, a family member was actually on hospice. And I went there and saw how it was and how beautiful it was. And that's when I approached Cathee and then approached Tristan of the idea. I mean, mind you, we've been working in the ICU, and Tristan was working in the ER for a while. And that's when I asked him, let's start something good for the community. And we came up with the hospice.
A lot of the previous podcast episodes we've had share a type of timeline. It's almost like a reset from 2020 on. It's almost like anything before that didn't exist for some reason. And I see and understand now that this global pandemic that kind of had everybody on a lockdown did not keep you guys on a lockdown. You guys were still out there battling day in and day out. I mean, that must have been incredibly stressful. And to think of something like this out of that's incredible.
So I have a little story. During the pandemic, it was still the idea was still new. I mean, we already started the business. I actually got sick. There was me and I work in ICU, helping. We were the first one in line, and I got sick myself. I was actually in ICU for a month where I didn't make it.
Almost.
And these guys were there to support me, and that's when I knew from the get-go that these are the guys that I want to go and battle with to go with and help the community. And my little thing for myself, the reason why I'm so into hospice is I sit there and thinking that's all you can do, sit there and you're isolated from everybody else. And talked to the guy upstairs and said, if he let me live. At the time I had a 1-year-old, and I asked him if he could let me see her grow up. I'll do God's work for him. And that's my little the reason why
It's a big reason why. There's not little.
I do God's work and trying to help as many people as I can. And I kind of have asked for a better team than have these guys by my side.
Wow.
Into hospice.
So you guys have truly seen it. And I guess my next question to you is, you've mentioned not only working through the pandemic as a frontline, first and foremost, you guys did as great a job as anybody could have. So thank you for everything you guys did during that time. It's a lot of tears, hard work, people within the industry that had to deal with that. And I mean, can't imagine that in the middle of that, you guys came up with this idea of creating something else. So why a hospice?
I think arguably, right, the main driver behind that was the pandemic. Like you said, a lot of the stuff prior to that seems like it didn't exist. A lot of things that happened during the pandemic, I feel like had a lot of reason to fall apart because there was a lot of chaos going on. But at the same time, what we saw was kind of like a light at the end of the tunnel. So to be exposed to something like that, which in hindsight was kind of traumatic if you think about it, because all we would do is for 12 hours at a time, try our best to do everything to save somebody because that's all we knew as nurses, right? Come to the hospital, we fix you, we make you better, get you back home to your family. We couldn't do that. We were trying everything. There was an internetwork of intensivists from New York pipeline all the way to coast. We were trying everything under the sun to try to combat something that was very new. With that being said, like I said, one of the drivers is seeing and being exposed to people being alone in a very isolated space, surrounded by people that they don't know and that are essentially irrelevant to their lives. Why not create something where you can take somebody out of that space? You can place them in a position where they're in a space that's comfortable to them, surrounded by the people that's most important. So again, the driving force behind it was, what can we do, not necessarily within the walls of the hospital? What can we do outside of them?
So I heard a story that you guys met in a garage somewhere to talk about all this.
Yeah.
Yes.
You guys share a little bit of that story and how that happened?
We just didn't have a space.
I know.
What I mean?
It was just like on the planning stage. We met. We all met. I think I came from night work, and then we met at Howard's garage.
And it had to do all to do with COVID. Also, there was not a lot.
Right.
Can you guys walk me through a bit of how Tranquility Sands works with the 9 cities in the Coachella Valley and beyond, and what is the process? And I'd love for you to also, I'm going to touch base on a few of the segments, but I'd like to start with where do we find the hospice? Where are you guys located? How does it work for me to say, hey, I have a family member, I love to do this? What's the process of that?
We are located in Palm Desert. That's where our office is. But we actually cover several counties: Imperial County, Riverside County, San Bernardino County, and all of us in Bernardino. But most of our patients are in the Coachella Valley, the High Desert, Moreno Valley, Hemet, and Menifee. And how can someone be on a services? Most times they have to reach out to their doctor, or they can, let's say if they're in a hospital or they're in a nursing home or they're in assisted living or boarding care or just at home, and they want to know if they can qualify. So most times they'll call our office, and then once they call our office, so they can look up on Google and you most likely see our reviews. And then once they do that, once they call the office, we'll do an assessment with them, and then they'll get an order from their primary care doctor. And once they get that, then we admit them the same day, and then we order the necessary equipment, the necessary medications, a lot of support, education, medication administration, wound care, and also social service part if they need placement or they need resources. And then we also have a chaplain.
Oh, wow. Okay, so you guys cover a lot of stuff. Not just chaplain, but everything that you guys help them with. I know you guys help them get baths as well. I mean, there's so much going on. You mentioned the educating part, and When I first met you guys, I mentioned this, and I'd love to talk on it. There is a big stigma when it comes to hospice care, and what it actually is. How are you guys fighting that stigma today?
Actually, it's really a big stigma for hospice care. That's why we're here to continue to educate. We're going to be nonstop educating what hospice is. Even I myself, I was just telling them, I just recently signed my 93-year-old dad for hospice
Mm,
because the stigma is that saying that, well, once you're hospice, you're going to die. Or once they're end of life diagnosis, it's just like the end of treatment right away. So a lot of community out there doesn't know that. My dad is 93-year-old. There comes a time that whether you like it or not, our body's just going to be deteriorating. We just have to accept that fact. So, and it's not just because you're in hospice, it's like the end of treatment already. We are going to be your added family support. Like what I tell our family members, we're not here to, we wanted to walk alongside with you, we wanted to guide you. We're like your added family support. It's not like we're preventing you from just taking good care of your
mm.
own family member. You can have that, but your body's just going to be needing that support, whether spiritually, physically. We have our social worker, whether you at least need like a day just to recuperate from that energy. We wanted to be that support for you.
So when you guys talk about educating the public or guests or however you want to mention talk to them, but when you're educating the general public, are you guys going into city meetings or schools, or how does it work when you guys are educating people that don't know anything about this?
A lot of the education is done through like in services. We work with a variety of different facilities, from assisted livings to memory cares to skilled nursings, even hospitals. We'll have many case management meetings with the individuals in those facilities that are kind of responsible for keeping an eye on their residents or their patients,
Yeah.
and at that point determining, is hospice something viable for them at that point.
So it truly
So
is like internal. Like you
absolutely,
as you're in the hospital going
absolutely.
through all this, this is where the education part comes in.
Correct.
Mhm.
Even community events, arguably, because
Mhm.
the population out here is very much, there's a lot of the older population. When I say older, I'm talking about the demographic of 65 years and older.
Right.
So a lot of those residents are out here, and a lot of the time they attend health fairs that we often attend regularly at various different locations across the valley, and they want to learn about resources, because at the end of the day, even though there is a stigma behind it, there is also the reality of, we're all going to cross that finish line. And knowing what's out there and what's available as far as support goes, I feel is vital out here in the Coachella Valley.
When somebody comes to your office and they're confused, they're lost, they just got all this information in the hospital, and they come to you and they sit and meet with the person, what's the approach you guys take when talking to someone that's learning about this for the first time?
I think we kind of ask them questions first to kind of understand what their issue is, because it's so important. And sometimes they'll call us, and we prefer to
Mm,
see face to face, because some conversations are just better face to face.
I agree.
And then we will just kind of have a what's going on. What's the challenging part about the family member? What are they falling? Are they having so many problems? And then once we have that assessment of them, then we can have a much better education tailored towards them.
Mm,
you know, because people are different in how they understand things. So, sometimes people just want medication, or sometimes people want caregiving services. Sometimes
yeah,
people do not qualify for hospice. So we kind of guide them, even if they don't qualify, we guide them to the right program for them to thrive. So,
good.
yeah.
That was definitely my next question. Not everybody can afford this. So programs exist for people that cannot. And you guys can help them find those programs and get them to apply. It's up to the person to apply and continue it, I'm sure. So I guess if you go through that process, you sit with you guys, and then that transition between, I'm assuming it's like a hospital to in your care. Is it dependent on time? Is it dependent on your ability to do something? Is it more like an immediate care that you guys then take over? How does that part work?
Depends. I would say setting definitely has a big role to play in that. What we try to avoid as much as possible is what we consider a quote unquote crisis situation. So a crisis situation is when an individual has been going through some type of disease that may have been progressively worsening over a certain amount of time, where they're hospitalized maybe multiple times. Those situations require us to be a lot more expeditious as far as timing and getting everything in motion, because at that point, we have maybe met them a little too late on that spectrum. Medicare says you have 6 months worth of a benefit as a Medicare beneficiary. That's 100% covered by Medicare. So, with that being said, if they're already in a position where there's been a significant amount of decline, and either the patient or the family would like them to be discharged home in a comfortable setting, that definitely impacts the way that we do things, as opposed to, let's just say, a primary care situation where you have a primary care provider who has seen the patient, 5-10 years, built a really good relationship with not only them but their family, and then they get to a point where they feel hospice is a realistic option for them. So at that point, it's a lot less. I mean, not to say that it's not as important, but the process is usually more personable in the sense that you're meeting with them in their home setting, you're talking to them. It's, you're not surrounded by doctors and bells and whistles and all of these different things going on and giving them all of this information when they've already been given so much.
Right.
Our goal is always to make sure that everyone is receptive to what we're telling them to a degree. And I feel like that's important in getting people to understand how important something like this is.
And so in you talk about how, removing all the sounds, all the bells, you're right. And it kind of a lot of things flashing at you at the same time don't help you make the right decisions. And to tie it back into the name of your hospice, I did want to ask you guys about the logo, what it means. And if you could share that with us. And now I'm understanding a lot better Tranquility Sands. You definitely take a moment to just breathe, right? I think. So can you guys share with me what the logo is, how it works, like what why this specifically?
So the logo in itself was derived from obviously the desert, because we're locals out here. We understand our community out here. We cared for our community out here over the years. So that's representative of those sand dunes that you see in the back. Now the green hand is representative of the support that we can give them. So it's kind of us cradling the Coachella Valley. And arguably, a lot of times people think that deserts are very lonely places. So for us to be there and to let them know that they're not alone
That's
is
fantastic.
huge.
Wow.
Yeah, we wanted to be like the healing hands of the desert.
It's fantastic. Thank you guys for that. So I want to talk now about the future of all this, because we want to make sure that you guys are here established today. It's an idea between 4 people that you guys have worked through the pandemic. It's some very harsh times, and you sat down somewhere and you came up with the idea to build all this. Where is your ultimate goal? Where is this all growing? What's the growth of it? Where do you see it going in the next 5-10 years? How do you guys see it continue to service more people?
I think just offering more services. Hospice is just one of the under the umbrella of end of life. So hospice can be one of them. And then sometimes patients get better, so you can put them in home health. So home health could be another option that they can go to. And then the other thing is palliative care as well. Patients might not be ready for hospice, but they might want to continue to get treatment. Let's say they have some type of cancer, they'll get the chemo. But at some point, they say, you know what, I don't want to get any more chemo. I want to just comfort only. So they'll go to end of life. Yeah. The reason we do that, the growth, is because a lot of people will ask us, a lot of the family members will ask us, what else do you provide? Because they really like our services. So they feel like we provide something more better for them. And then in terms of growth, like geographic area, we are very comfortable being around the Coachella Valley area. I think we are a local company. I know I always say that we're a local company. We're a nurse-owned local company. We're very familiar with the valley, our demographics. So I think just educating more people, reaching out to the East Valley, a lot of that because of in terms of the cultural aspect of it. Yeah, that's what we're trying to do. So just keep educating, keep improving our services, keep offering more services that we can.
It's very cool. I always ask all my guests to think about a moment in time where they weren't thinking of all this and what they're doing today. And I'm just going to ask each of you. This is one question I always try to get in. before all this happened, before Tranquility Sands, before you guys were nurses, before the success you have today, uh, where were you guys prior? I'm going to take you to a really further back point in time. I'd like to hear what each of your guys' first jobs were. What was your first job that you ever had?
I was a caregiver.
You were always a caregiver.
Caregiver.
You always been in. That's fantastic.
Caregiver. Yeah, I was a caregiver.
Okay.
After graduation, I had my private. I was like a private nurse before I passed my entrance.
Okay, fantastic.
Good.
Jump in anyway.
I was a certified nurse assistant at a
Okay.
nursing home in Indiana.
Wow, that was your first job. Oh my gosh, that's cool.
Yeah.
How
My
about you?
first job, my dad was a head chef for a golf course out here. At the time, it was Mesquite Golf and Country Club.
Okay.
Ramon and Farrell. It's not like a wildlife preserve. But anyway, I bus tables. And
Okay.
that was kind of like my first introduction to the workforce. My dad said, "Hey, why don't you come hang out? We have a big party tonight. Put some
There you
work in.
were.
You can make a little side money for your candy or the ice cream man or whatever it
You never
is."
know.
And that was my very first job.
Okay. How are you, Howard?
I worked downtown in Palm Springs
Okay.
before the whole section was rebuilt, but there's a little ice cream shop called TCBY.
Okay.
Worked there for many years, and then I moved on to Crazy Shred across the street, and I worked there
Okay.
for a good decade.
That's the reason I ask this is because I'd love to give you guys a chance to talk to anybody listening or watching and ask you what your pearls of wisdom are. And that segment was created because of my brother a long time ago. And it's crazy. You don't ever know who's listening. You never really know who you can inspire. So I'd ask of you guys to take a second and help me inspire someone else. What do you guys do to say, have the success you have today? There's no guidebook. What are your strategies? What is it that you guys do that you could tell somebody, hey, if I were you, I'd do this and this to be successful? It's a tough
Yeah,
one.
no, that's a good.
For me, it's don't be afraid to fail. Always be intentional in what you do. Be consistent. Always experience all type of jobs that you can. Any type of experience that comes your way, jump on it. Any challenges, jump on them. It just makes you better. You just learn more. And the more you learn, the more knowledgeable you are. I think the more marketable you become and the more confident you become. I always believe that I think knowledge brings a lot of confidence.
Going to the nursing field before I went to school, I've never stepped in a hospital setting before, but I knew I wanted to help people. That's why, of course, with Tristan's mom, who was a big influence.
Right.
So, but just being where you're following your heart and helping people, making a difference in our community and to the world. That was my contribution to trying to help someone. And that's where nursing was the perfect fit, and I was the best decision.
Mine was I've been an ICU nurse for 27 years. So all those time it's a critical care thinking basically until I became a hospice nurse. Before during my career in the early on, I applied for a hospice job, but at that time I don't think I fit because I was thinking to myself like it takes a special person to be a hospice nurse. Moving forward to today, I would say that during my 27 years of ICU, I've never cried as much as I started in hospital.
Wow.
The first thank you that I've heard from a family member, I I I cried a lot because they meant well. It came sincerely. During the pandemic, I was like one of the frontliners for rapid response. Thank you doesn't mean anything at that time. But the first thank you that I heard from a family member or from a patient myself, I cried. So it takes a special person to be a hospice nurse. So and we're proud to say that.
But just because she's
Give
been
it to
mentioned
me.
a couple times, her name is Nelia.
I was gonna say we've been talking
She's
about
been
your
mentioned
mom.
a couple times.
Yeah.
And you can tell just by this group alone the impact that she's had in the Coachella Valley as a nurse. The reason why I wanted to do that is because it really is. She's been kind of a guiding light for me, and growing up, not necessarily understanding a lot of her teachings when I was younger, but now being an adult, purpose is the number one piece of advice that I would give people, because now I understand why she does what she does, why she works the long hours, why she's so dedicated to her position as a nurse, at the hospital.
Yeah.
And I truly believe it's purpose. So now incorporating that into my life, having a purpose in a world that's so full of task-oriented things, your purpose is always going to be the driver. So my number one piece of advice for anybody out there wanting to get out and get up to do something, better than what they're doing now, is just find a purpose.
Wow.
Let your purpose carry you into the future. Because as long as you keep your eyes on that, the rest will fall into place.
So to sum it up, what I just heard from each of you, you have to have a purpose for what you do, a love for what you do. Don't expect it, but know thank yous are coming, and always focus on what you need to do to move forward. I think if you were to put all those together in a room, your success is inevitable. You guys probably have way more success coming your way than you can imagine. It sounds like you said it, Howard, earlier. You guys really kind of have a fit, and I see it and it works, and it's really great to hear you guys talk about all this. It's really fantastic. Um, Really quick, as we wrap up the episode, guys, I just want to know what's the best way that we can find out more about you. What are your social media handles? How can we reach out to you? So you guys do have social media handles.
Absolutely. Yep.
And what's the handle?
Handle
What's
is Tranquility Sands Hospice. So on
All-
those social media platforms like Instagram, primarily we're really active on Instagram and Facebook.
Great.
We put out a lot of hospice education for anybody who's, adapted to the digital realm of everything, trying to
Right.
get more information out. You can
Fantastic.
also find us on www.tranquilitysandshospice.com. Sometimes it might be difficult for somebody to call the office and speak to somebody. So
Yeah.
there's a little section in our website where you can actually submit an inquiry and do it that way. And then we will
Perfect.
contact you immediately once we get that, so we can discuss a little bit more about how we can help.
Okay, but thank you guys so much for joining me at this show. I can't wait to sit and go through all the stories. They're fantastic. And guys, to all of you tuning in today, don't forget to check out Tranquility Sands. They really have a fantastic company out here in the Valley. I will let you know we are still able to find you guys are still able to find us over at the new mindset otcv.net. If you guys have any questions for them, we'll also make sure to have links on our site, on our website, Instagram, social media, and everything else. Guys, this has been a fantastic episode. Thank you for being
Thank
here
you so
once
much for
again.
having us. We
And
really
to all of
appreciate
you
it.
guys out there, if you're watching us this morning, thank you for joining us. If you're listening to us or watching us tonight, have a great night. Bye-bye.